सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632।
Namaskar and a very warm welcome to all the viewers who are watching Sahyog session on Avidya channel number 6 to channel number 12, and along with on our official YouTube handle. These are NCERT official and NCERT PM Avidya class 6 to class 12 YouTube channels. My name is Srijan Rajput. Here we are joined by sign language interpreter Anushka Sharma. Anushka, warm welcome. And the viewers who are watching us Sahyog session, as you all know that Sahyog and Paricharcha sessions are brought to you by Manodarpan under the initiative of Ministry of Education as a part of Atmanirbhar Bharat Abhiyan for psychosocial support and mental well-being of viewers, students who are connected with us across the country. In today's Sahyog session, we are going to talk about another interesting topic, that is recognizing and addressing adolescents' mental health. For this topic, if you have any queries or doubt or you want to know more about this topic, so first note down Manodarpan counselor's number, and the number is also flashing on your screen. Number is 844-844-0632. And please note down our IVRS number, that is 8800-440-559. And viewers who want to write up, so please note down our mail ID, and the mail ID is sahyog.ncert@cet.nic.in. Viewers who are watching us our official YouTube handle, so please note down here live chat box option is available to drop your comment and queries. Without any further delay, time to meet our today's panelist. We are joined by Dr. T.V. Somashekar, RIE NCERT Mysuru से. Sir, आपका स्वागत करते हैं. नमस्कार.
Namaskar.
And here we are also joined by our practicing counselor, Ma'am Dr. Bharathi Kulashekaran. Ma'am, namaskar. Warm welcome. Good evening.
Namaste, ma'am.
So, as I mentioned earlier, that our topic is recognizing and addressing adolescents' mental health. So, Sir Dr. Somashekar, how do we recognize adolescents' mental health issues at early stage?
Yes, it is a very crucial factors. Since adolescent is a transition period which passes through childhood to adulthood period, and we know that it starts from 13 plus age and goes up to 18 plus years. So during that period, there is a lot of physical change, biological change, and even the psychological changes that happens within the individual. All these things because of the biological changes that happens within the individual body. There are varieties of secretion of hormones into the blood glands, cell, blood veins. And because of those, so we can see there is a sudden spurt and sudden growth in the adolescent period. And this is the setting stage for the setting into the adulthood period. So therefore, this is a very formative stage for the adult life and for the future life. And in this particular group of people, so they are transiting through varieties of stress and strain conditions due to the biological and physiological conditions that they undergo. And now in the present context, so globally, those who are in the age of 10 to 19 years old, 1 in 7 of the people, they experience a mental disorder. So that means here, they are not able to think, they are not able to analyze, they are not able to articulate what they think and what is the correct response to the questions other has asked. So if they are not able to interlink with what is their thought process and what is their responses, then we say they are mental disorders. And these kinds of people who are suffering from mental disorders, they are accounting for 15% across the globe. And it is happens to be, if it is not addressed, then it happens to be the diseases in this particular age group. And among those mental disorders, so majority of the disorders that we see in the areas of depression, anxiety, and behavioral disorders. So these are the prominent mental disorders that we think about. So here depression is where the child comes into his own mental stress and conditions, and where he is able to see that he is not able to cope up with the present condition because of his own mental abilities. And because of those factors, he feels that there is not able to accept that, or is not able to deal with that effectively, and therefore he comes circumscribed to that kinds of pressures, and therefore it turns out to the depression. Anxiety is that where he feels that he attempts to get a success, but anticipate he may not get success, and faces a failure and doesn't have the mechanism to accept the failure. So in those conditions also, we have anxiety disorders. And we have varieties of behavioral disorders where we see that adolescents doesn't accept the social norms, and they show the deviant behaviors. And because of that, we try to see there are varieties of adolescents behavioral disorders that are there. So even you can see that. So in the age group of 15 to 25 years also, there is a suicidal cases reported in that age globally also. This we can see during the examinations, and also when the results are declared by the respective boards, then we can see the reporting of the suicidal cases by the different medias. So this is also, suicidal tendency is also another kind of a mental disorder. So these are the varieties of issues that are there. So mental health is not just only related to the mental activity, it is also related to the physical, it is related to social, related to emotional, and also it is spiritual domains also. So all of them happens continuously and concurrently, and therefore it is a very challenging situation for us to look at it very separately and try to demarcate it and say when this is going to set in. So what are the ways? And there is another problem with this is that it is in some teenage group of people, this becomes a normal behavior. In some cases, it becomes a deviant behavior. So therefore, there is a very, very thin line to distinguish between the teenage problems and the mental health issues, mental health or mental disorder issues. But there are varieties of signs and symptoms which every individual in that age group exhibits. And if the observers are very keen in noticing those changes, then they can, to a certain extent, make a conclusion that a child may be undergoing a mental health issue and requires a professional counseling services. So it is in that way we try to understand how do we understand the signs, and by understanding those signs, how do we support them, and how do we encourage the early interventions. So early intervention we are talking about because it is better if you try to notice them in the initial stage and try to provide appropriate guidance and counseling services to them so that they can overcome from this issue from that adolescent period. So if it is not addressed at that stage itself and during the adolescent period itself, okay, previous slide please, okay. So it is there, then they may feel that it may continue to adulthood period also, and it may continue towards its life cycle also. So it is better to address them as we notice their signs and symptoms and provide early interventions. That is the reason we say it challenges often begins during adolescence. That is, all mental health issues starts commencing during the adolescent period, because the adolescents, they don't discuss the issues openly with the elders or siblings or peers, and therefore they confide themselves into those ideas and they try to hide it. So that may lead to varieties of mental disorders. And then if you don't prevent the escalations and if you don't support their healthy developmental activity, then it may lead to the varieties of deviant behaviors. Now, how do we understand? Next slide. So how do we understand them? What are the ways we can do it? So here, it is not a single individuals, not only by the teachers, it is a collaborative effort. We need to take the collaborations, support of the parents, support of the peers and the other teachers who are concerned with the work. So it is in that way we can look for. So how do we watch them? How do we observe them? What are their signs and symptoms? By looking at their natural behaviors they exhibit in various contexts, or we can do that. So we try to understand these mental health issues in major issues. The one of that major area is emotional and mood changes. So that is, emotional behaviors are rapidly happening here, and we want the child to have the positive emotional behaviors which take them to joyfulness and pleasure. If the child is not moving towards that in a positive direction, and if he faces the negative experiences in his life, it tends to give the negative impact. So it is in terms of their sadness, their tearfulness, and irritability. So that means, yeah, these are the negative effect of the emotional criteria. So he is being pulled toward the negative factors because of various other factors. It is not only within a, maybe a social factor or the situations in which he is interacting that he may do it. And for such kind of children, there is a mood swing. So that means here the moods appears as a waves, and sometimes they become like a tremors, sometimes they become very mild, and these are because of these changing fluctuations of their moods. So they exhibit different kinds of behavior. Sometimes they look very happy, very next moment they show the aggression behaviors, and sometimes they become very, very naughty also. So it is these kinds of mood swings can be seen. And then sometimes they may also exhibit the emotions like feeling of hopelessness. So that is, if you talk to them, they don't talk in a positive sense, they always talk in the negative sense. And by showing all those things, talking about that, they show their own self-esteem. So that means they don't believe in themselves. They don't believe that they have the potential, they have the coping system, they have the mechanism to overcome that. So let me try that. They don't look into that, but they feel that, no, I am not able to do, I am not good, I will not be successful in my attempts. So these thoughts process make them to go for hopelessness conditions. And even sometimes, even if they make any attempt in the positive directions, so there may be overreaction to rejections and criticism. So that means here, the people who are suggesting some positive ways to them, saying that it is not a good behavior or it is not desirable, still they may say it, no, you are saying it purposefully, you are not liking me, so you hate me. So all these things, they take it in a negative directions. Next slide. So then we look into the behavioral changes. What is their behavioral patterns that we can see in school, even at home? So that is, they may show the withdrawal tendencies from all social gathering activities. Okay, it is family activity, or it may be mingling with the friends, or trying to participate in a group activities. From all those things, they try to withdraw. They don't want to voluntarily participate unless it is forced. They don't like to participate. So they are showing the withdrawal tendency from every social gathering activity. Next, they may also show the tendency of skipping schools, or they may also reflect their performance in terms of dropping in the academic performances. So for example, in their first terminal examination, maybe in the first monthly test, the grading may be A, and in the second month, the grading is B, and in the third month, it may be grade C. So that means they show that the grades are dropping. So that means they don't have interest in their performances, or to maintain that consistency, or they are being pulled by their negative thoughts, and therefore there is a drop in their academic performances. And also the parents can see that there is a change in their sleep patterns. So they might be sleeping from 9 p.m. early, and now they are not going to sleep at 9 p.m. They may be watching social media platforms or television up to 11, and even they don't have the complete sound sleep, disturbed sleeps they'll be having. And this also leads to insomnia conditions. And it also, we can also see they have the different eating patterns. So that means sometimes they don't have the eating timings fixed. So they may eat less, sometimes they may eat more also, depending on the conditions and the moods that they have. So these kinds of eating patterns changes also can be seen at home by the parents. And next is they are taking the risk-taking behaviors. So that is, here they are very adventurous. They want to risk their life, and they want to expose themselves to very hazardous situation and try to experience all those things. So like this is those things that are there. The next area that we can look for and get the signs are cognitive and physical symptoms. The cognitive signs, as been said here, it is trouble in concentrating or
Sir,
making.
request to wrap up your answer. We'll move further.
Yes. Okay. So next is the physical signs. You can also see that they may be complaining. I have the physical stomach, this headache or a stomach ache or various other cramp in my body, and there is low energy within me, and there is no motivation for me to do anything. So all these things are going to be seen in that way. And then there is a self-forming behavior also, which they try to show it at different things. And the other areas that they show the signs is social and communication changes. So where they don't interact with, mingle with the group and try to communicate in a accepted manners that is desired. So they try to avoid all those things. They don't try to mingle with their peers also, with their best friends also, and they try to express their difficulty in expression of their thought. And they show the less interest in even making any conversation, whether it is school or related or among the social related areas. They try to withdraw from all those kinds of conversations.
Yeah, thank you so much, sir. That was really insightful. In today's Sahyog session, we are discussing recognizing and addressing adolescents' mental health. So, Dr. Bharathi, how do we address it before it could become a fully blown disorder?
Yeah, more than anything else, we need to understand what is early intervention in mental health. It is nothing but the proactive identification, which has been clearly explained, and management of those emerging symptoms. That's very important. Then addressing the risk factors before they evolve into severe psychological disorders. This approach you can emphasize with early warning signs, recognizing behavioral, emotional, and cognitive changes. As it was told, it is one important aspect. And the second thing is the timely support, implementing the interventions promptly to address the root causes and symptoms, and then preventing them from escalation. And then a holistic strategy is very much important, utilizing psychological, social, and medical tools to manage and alleviate symptoms. This framework is particularly crucial for adolescents because it influences their emotional, social, and psychological development during formative years. What happens if it is not addressed? See, if we fail to address adolescent mental health conditions, it will extend it to adulthood, it impairs their physical and mental health, it limits their opportunities, and lead to, they will not be able to live their life fulfilling as adults. So, one more thing we cannot forget is the mental health conditions are particularly vulnerable to social exclusion. There will be discrimination, stigma is attached to it, educational difficulties will be there, risk-taking behavior, physical ill health, and human rights violation. See, all these things will create a hell to an adolescent. So, early detection and treatment becomes more and more crucial. And we will have to avoid institutionalization, first of all, and then over-medicalization can be prevented. Prioritizing non-pharmacological approaches is also very crucial, and then respecting the rights of the children. We just cannot forget any one of this. And then addressing adolescent mental health issues before they become full-blown disorders. It involves early identification, proactive support, and strong prevention-based approaches across schools, families, and communications. How it has to be done? How can we address this? This is the crucial question. We will have to create an awareness in education and families both. We will have to teach adolescents about their emotions, how to regulate it, stress management, what exactly is mental health, and how resilience can be achieved. We can use school programs to reduce stigma attached to it, and we should always encourage them to have an open discussion. And then they should be able to, seek help from others when they are in trouble. And one more suggestion could be like, we can integrate mental health curriculum into the school syllabus as mandatory, so that an adolescent gets into trouble, he or she will be able to notice it within themselves. And then the second most important thing is fostering strong support systems, encourage positive relationships with the family. And an adolescent is not created in vacuum. He or she has been born and brought up in a family where you have parents, grandparents, and other significant people around. So we need to have a positive relationship with them. And peer influence is very important in adolescent development and mental health. And teachers. Teachers play a very important role in their lives, and of course the mentors. So we will have to provide them safe environments for talking about feelings, and then we will have to train the adults who are involved in adolescent development, and then they should be able to spot early signs and offer non-judgmental support. And next, when we move on to the strategy or intervention part, we should be able to build emotional and coping skills in that, and teach them stress management, how to regulate their emotions, and problem solving skills, conflict resolution skills. And then we can give them practices like mindfulness, journaling, or relaxation techniques. We can include yoga, pranayama, everything in their curriculum. And then we can encourage them to have a healthy routine. As far as sleep is concerned, it should be regular. Exercise should be mandatory. And we cannot ask the children not to touch the gadget at all, because the present adolescents, I would say, they're addicted to gadgets. At least we can suggest them how to balance the screen time. And then very important, most important rather, is having a regular screening, early screening and regular check-ins. The way we do the physical examination, health examination in the schools, it's better to implement mental health screening also. And during routine health checkups, it can be added. And then we can even train teachers, counselors, and healthcare providers to ask the right question properly, right questions early. That is very important. And not only that, the adolescent might not have any problem, but they might be at risk. So we will have to monitor at-risk teens. For example, those with the family history of mental disturbances, or if the adolescent has been exposed to a trauma recently, we can predict, we can expect certain psychological imbalances in the child. And then, more than anything else, we should be able to give an access to the mental health services. We will have to ensure they have an access in the school itself, school counselors, psychologists, and therapists. We can create youth-friendly, confidential, and affordable services. We can offer low-threshold support before the crisis develops. As I told, when there is an early indication, there is no need to go for a very serious intervention. A peer support group, helplines can be made use of. And then it is not only managing the symptoms. We will have to address the root causes and risk factors. If there is a bullying issue in the school, that has to be tackled. And then academic pressure is creating a lot of psychological issues in adolescents, that has to be addressed. Discrimination because of socio-economic status, that is one hazard. And then family conflict might be contributing a lot to an adolescent's psychological health. And we will have to ensure a safe and inclusive environment at home and as well as in school. So we will have to support socio-economically disadvantaged families with community resources if needed. And then it is a triad: family, school, and the mentors. It should be a triad, and then adolescent is very safe within that. So educate parents and adolescent development and mental health science, because most of the times parents think that it is normal adolescent behavior. There is no need to give serious attention to this. Many a times still it gets into a serious problem. Parents will be thinking that it will be all right by the time they become adult. Then again, intervention will become a more problematic issue. So we will have to promote healthy communication and active listening even at home. And then we will have to encourage routine family activities to build connection and trust. it is better to call the families if we find any problem with the adolescent, talk to them, give them
Yes.
suggestions, advices, and then direct them, guide them to go to the professional counselors or psychotherapists if the problem is very serious. But the early recognition can happen only at school and
True, ma'am.
at the family.
Yes.
And the final thought about this is, I always believe prevention is protection. So by
Yes.
catching concerns early and creating environment that supports mental wellness, we can definitely prevent many adolescent health issues from escalating into serious disorders.
Yes, ma'am. Very well said. Let's support adolescents early to build resilience, prevent disorders, and ensure healthy futures. In today's Sahyog session, we are joined by our esteemed guest of panelist, Dr. T.V. Somashekar from RIE NCERT Mysuru. Sir, thank you so much.
Thank you.
Yeah.
Thank you.
Thank you.
And
Namaste.
thank you, Dr. Bharathi Kulashekaran. Ma'am, thank you so
Thank you.
much.
Thank you very much.
जी हाँ, बिल्कुल। मानसिक स्वास्थ्य की जब भी बात होती है तो हमें हमेशा पहले ही सचेत हो जाना चाहिए और तैयारी करनी चाहिए ताकि हम अपने भविष्य को और मजबूत बना सकें। सहयोग सत्र को यहीं समाप्त करते हैं। आपको कुछ ज़रूरी जानकारी देते हैं। क्लास 7 और क्लास 4 की न्यू NCERT टेक्स्ट बुक आप सभी अमेज़ॉन, फ्लिपकार्ट और NCERT की ऑफिशियल वेबसाइट से ऑर्डर कर सकते हैं। चलिए देखते हैं कल प्रसारित होने वाले सत्रों की एक झलक। सुबह का पहला सत्र योग शक्ति होगा, जिसे 8 से 8:45 तक प्रस्तुत किया जाएगा। योगिक प्रैक्टिसेस टू रिलीज शोल्डर टेंशन हमारा विषय रहेगा। समय 10 से 11 का चैनल नंबर 9 से चैनल नंबर 12 तक प्रसारित किया जाएगा सत्र चिल्ड्रन लीडरशिप टुडे फॉर अ स्ट्रॉन्ग इंडिया टुमारो टॉपिक पर। उसके बाद 12 बजे इंक्लूसिव क्लासरूम का सत्र क्लास 6 स्टूडेंट्स के लिए होगा। हिंदी का विषय जानेंगे कबीर के पद। 12:30 से 1:30 तक चैनल नंबर 6 से चैनल नंबर 12 तक आप सभी साइंस का सत्र देखेंगे, द फंडामेंटल यूनिट ऑफ लाइफ। इसके बाद क्लास 9 स्टूडेंट्स के लिए 2 बजे का सत्र होगा, जहां सोशल साइंस का विषय फंडामेंटल राइट्स आप सभी के लिए प्रस्तुत किया जाएगा। 2:30 पर क्लास 9 स्टूडेंट्स के लिए मैथमेटिक्स का टॉपिक जानेंगे, लाइन्स एंड एंगल्स पार्ट 1। 3 बजे का सत्र क्लास 10 स्टूडेंट्स के लिए होगा और सब्जेक्ट साइंस दिस इज इलेक्ट्रिसिटी पार्ट 1 टॉपिक रहेगा। 3:30 पर जमात 10 के बच्चों के लिए उर्दू का सत्र लेकर आएंगे। उन्वान है ओ देश से आने वाले बताओ। परिचर्चा सत्र भी आप सभी चैनल नंबर 6 और 11 पर देखेंगे 2:30 से 4 बजे तक। कल परिचर्चा का विषय है स्ट्रेंथनिंग स्कूल्स एंड कम्युनिटी फॉर प्रिवेंटिंग स्टूडेंट सुसाइड्स। और उसके बाद आप सभी ऑनलाइन ट्रेनिंग प्रोग्राम भी देखेंगे 4 बजे से 5 बजे तक चैनल नंबर 6 से चैनल नंबर 12 तक। और विषय लीडिंग प्रोफेशनल्स डेवलपमेंट ऑफ स्कूल हेड्स एंड इट्स इम्पैक्ट ऑन स्टूडेंट आउटकम्स, अ केस फ्रॉम केरला। सहयोग सत्र आप सभी के लिए प्रस्तुत किया जाएगा और यहाँ सेल्फ रेगुलेशन अ क्रूशियल फैक्टर टू साउंड मेंटल हेल्थ विषय है। नीपा NCSL का सत्र आप सभी देखेंगे लीडिंग होल स्कूल्स डेवलपमेंट इन नेताजी सुभाष चंद्र बोस आवासीय विद्यालय मणिपुर से। तो आप ये सभी सत्र ई विद्या चैनल के साथ साथ हमारे ऑफिशियल यूट्यूब चैनल पर लाइव और आफ्टर लाइव देख सकते हैं। हमारे साथ सत्र को इंटरप्रेट कर रही हैं अनुष्का, आपका बहुत बहुत धन्यवाद। मैं सृजन राजपूत हूँ। अब आप सभी से समय है कि अनुमति ली जाए। नमस्कार।